And on this Transformation Tuesday, I am starting a new series which I am calling it as the Facelift series. So this Facelift series is going to explain to you the fundamental differences of what is a facelift, how a facelift surgery is performed, what is the recovery time. And so this Facelift fundamental series will have 5 to 6 sessions which will be done every Tuesday from today onwards. So the first session today is going to focus about when should one stop using fillers and think of getting a facelift instead. As we all know, getting fillers done for enhancement of the face, be it for the temples, be it for the cheeks, be it for the lips, is a very common thing. A lot of patients like getting fillers done because they have a very less recovery time, very less of a downtime, and you can resume going back to work very soon. But is filler something which we can keep getting done repeatedly over many years? What happens to the face or what happens to the skin if you keep getting fillers done again and again over a period of time? And when is the time when you should think of stopping the fillers and maybe think of something more permanent such as a facelift? So this is going to be the topic of discussion today. So as I said, this is going to be the first in the series of our facelift fundamental series, and the topic for discussion today is going to be when to stop using fillers and get a facelift instead. I am Dr. Parag Telang. I am the founder and director of Designer Bodies, our Center for Advanced Cosmetic Surgery, which is located in Mumbai, India. So friends, fillers have been in vogue for almost 25-30 years now, and for so many years whenever someone needed more volume, filler was a good option. Filler was something which was the go-to treatment that most of the doctors would advise, and it was also a treatment that the patients used to like because of the less recovery time or less downtime. As we all know, as we age, we tend to lose volume from certain aspects of our face. So we start having hollowness, which may be in the under eye area, there may be some hollows in the temple areas. These creases start becoming more prominent again due to loss of volume in these areas, and this overall lip appearance is that of loss of volume or loss of tone. So this is a constant process. I mean, if you compare the journey of this patient from her 20s to her 30s, 40s, 50s and then 60s, what has changed is the volume. So fillers are a good option of replenishing this volume. So the under eye, laugh line, the lips, cheek areas which are becoming hollow, yes, fillers can be a very good option for restoring volume to these areas. But then what happens if you keep doing fillers repeatedly? So fillers are used for various areas of the face. It helps one build confidence, it reduces the areas which are looking hollow, and in general it will make someone's face look more fresh and without much of a recovery time because it's a simple procedure. These are basically hyaluronic acid gels which are manufactured by various companies, and they have varying consistencies, varying viscosities. So there are different types of fillers for each area. Fillers for the lips are different, fillers for the cheeks are different, fillers for the chin are different. So depending upon what treatment you want or which area you want to treat, the doctor can recommend a specific HA filler for you. HA stands for hyaluronic acid. So these, as is seen in these photos, these are just injections. There is no surgery involved. So you come to the clinic, there is a numbing cream which is applied, and then you can get these fillers done. But then what happens if you keep doing these fillers over a period of time? So if these are some areas which are an area of concern for you, such as the laugh line which has become prominent, the under eye which has become hollow, the cheek which is looking hollow, or the chin area which needs more plumping or enhancement, then for all these areas fillers are very good options, no two ways about it. You can definitely think of a filler for these areas in your face. So if you have static lines like the laugh line, under eye, corner of mouth, fillers are good options for replenishing these hollows or to get more volume in these hollows. But then the point of discussion today is what happens if you keep doing fillers repeatedly. If you do filler in 2024, you do it in 25, 26, 27. If you keep repeating your fillers again and again every year, what is exactly going to happen to the face? So there is a term which has been coined, and the term is filler fatigue. So what exactly is a filler fatigue? Well, a filler fatigue does not mean that the filler has stopped working. It just means that it was probably injected in a wrong manner or in a wrong plane, and that is not how it was supposed to be injected. Riya Chawate is asking, lip filler is good for a long time. For sure. As I said, fillers are very, very safe and they are very good for majority of areas of the face. But then there is a term called as filler fatigue. So let us understand what this filler fatigue is. So the idea behind filler fatigue is that over a period of time, the skin stretches out because the filler is going to push the skin like a balloon. So over a period of time, the skin could stretch out and it could, potentially keep needing more and more volumizing or more and more filling in order to maintain the strength of or tightness of the skin. So if you are getting 1 cc of filler done maybe in 2024, by the time you reach 2027, you will end up needing 3 syringes or more because the skin starts becoming a little lax as you keep injecting fillers. This is not so much for the lips as to other areas of the face. So constant filling causes constant stretching of the skin's fibers or the dermal fibers, and since the fillers dissolve, you eventually need more and more fillers every year to maintain the same appearance or to maintain a youthful appearance. But then in order to get this done, you end up with these kind of problems. So this is called as a facial overfilled syndrome or a filler fatigue. So what is a filler fatigue? Is that if you are repeatedly getting fillers injected in the cheek skin is going to become very, very loose, or it is going to get stretched out over a period of time, and therefore if you were doing 1 syringe to get a nice and tight look or a lifted volume here, you may end up needing 2 syringes or more. Similarly for other areas, for the chin, for the temple areas. So this is what a filler fatigue means, or a filler overfilled syndrome means. And I am not talking just randomly. There are several examples of very well-known celebrities whose faces have changed beyond recognition. You see how nice and fresh the face is on this side, and you see the face that is seen after many years of treatments with fillers. This is called as filler fatigue. So you can very well see that she has got fillers done on the forehead, fillers done on the cheeks, the fillers are done on her chin. So this has taken away the freshness of the face because the skin elasticity has started to get altered because of many years of use of fillers. So this is what I mean when I say filler fatigue. Another example, again a well-known and a fresh face, and you see how nice and fresh the face is before she started doing treatments, and this is the end result after many years of treatment. Of course, she doesn't have wrinkles on her face, which would be what she would have if she didn't do the treatments, but then the price to pay is this kind of a skin appearance where the skin has changed beyond recognition. The skin doesn't look fresh anymore and the face doesn't look fresh anymore. This is because of too much of filling of the face with fillers, and this is what is called as a filler fatigue. So then when is the time to think of a facelift? The first part you understood that after many years maybe you may not be good candidates for doing fillers, but then what is a facelift and how can you plan, or when should you think of a facelift? Normally, if you stand in front of a mirror and you do this simple test where you are pulling your skin upward like this, if you see a lot of skin bunching up here, you see what is happening when I am pulling her face skin upward. You will see a lot of skin which is bunching up here. So it means that you have reached a stage where there is too much of elasticity on the skin, and the fillers are not going to stretch out your skin to the same extent as what a surgery can. And plus, the advantage of surgery is that this excess skin which is bunching up can be removed through here, which we cannot do when we do any kind of non-surgical alternatives. So you should think of a facelift probably by your 40s or 50s, when you feel that the skin has started becoming loose. Of course, those of you who have lost lot of weight, maybe due to bariatric surgeries or maybe due to pregnancies, will have this kind of laxity earlier in life. So this age of 40, 50, what I am saying is not a hard and fast rule, but whenever you feel that the skin has now really started sagging or the face has started becoming loose, that is the time when you should think of a facelift. So facelift, of course, is a surgical procedure in which there is an incision which starts in your hairline. It goes in the crease of the ear and then goes in the lobule of the ear, and the different layers of the skin are separated and they are lifted and they are stitched to a higher level, and this is how the face is made nice and tight. So when we do a facelift, of course next week when I talk about the techniques of facelift, I'll explain in greater detail how the facelift is performed. So there is a layer under the skin which is called as the smash layer, and this smash layer is tightened in a specific manner so that the face becomes tighter, the neck becomes tighter, you have a better definition of the jawline, the corner of mouth, all this sagging gets basically corrected, and that is why the term is called as a facelift. So the incision for a facelift, as I said, starts in the sideburn, it goes in the crease of the ear, and then it gets concealed in the crease of the ear lobe. Then the incision continues behind, inside the hairline. So these incisions are very inconspicuous. After a period of 2 weeks to 3 weeks, these incisions are not even visible. So facelift is a good option when someone has lot of sagging in the face. When there is lot of sagging, like the skin is loose or the neck skin has become loose, like this, where you can see there is a laugh line, there is corner of mouth, the skin has become loose. So facelift or a neck lift is a good option for tightening the skin in these areas of the face. You see how nice and tight the jawline has become after the face and the neck lift. But then facelift is a surgical procedure, so it is something that you will really need to plan properly and get it done. But after a period of time, just doing more and more fillers, trying to stretch out your skin and trying to make it look youthful may not work. As I said repeatedly during this talk, it is not that fillers are bad. I am not at all implying that fillers are something which are not good for anyone. Fillers are the best modality of rejuvenating your skin, but then people do tend to over abuse it, or they really tend to use fillers which are unindicated or which are really not going to improve the aesthetics of the face. In fact, the face starts looking very weird and overfilled. Always remember, it is like filling air in the tires of your vehicle. When you fill air in the tires of your vehicle, what is going to happen if you overfill the tires? They are either going to burst or you are not going to be able to drive your vehicle. Similarly, think of your face as the tire of your vehicle. You can fill it optimally, you cannot overinflate it, and doing many syringes of fillers is only going to overinflate your face. It is not going to look natural, and then it will also stretch out the skin so much that you end up having loose skin which needs more and more filling in order to support and give the same tightness. So maybe by the time you reach your 40s or 50s would be the time when you should think of something which is going to lift up the skin, tighten it, and remove the excess skin, which is done in the form of a facelift. Riya Chawate is asking facelift recovery time. Well, recovery depends on the type of facelift that you do. If it is a mid facelift, which is mainly for the cheek area, the recovery is around a week. If you do the whole facelift and the neck lift, the total recovery time is around 10 to 15 days. So I will be explaining the details about a facelift surgery next week when we continue this discussion on facelift fundamentals on the next Tuesday that comes after this. So friends, fillers and facelift are two aspects of treating facial aging. Both are very good devices for improving facial appearance, making a person look fresher and healthier, which is all that we all want. But then each process has its own indications, it has its own limitations, and we should not try to stretch out a procedure where it is unindicated. I send so many patients back saying that you don't need a filler or you don't need a facelift, because that is what it is. What we are talking about are scientific treatments, and I believe as doctors it is our moral responsibility to educate our patients what is good for their eventual outcomes. Nobody wants to have patients who look overfilled, nobody wants to look overfilled themselves for sure. So if you are not going to do a specific treatment for yourself, you should not recommend the treatment for your patients as well. And I will close today's live on this particular topic. So we will carry forward this discussion again next Tuesday and understand a bit more about the surgical aspects of facelifting. Dr. Sheetal Korde is asking, is thread lift procedure something which can help? For sure, yes, we do a lot of thread lifts at our center, and thread lift again is a very good modality of tightening specific areas of the face. Again, the patient selection is the key. I feel thread lifts work best when you do them for patients who are in their early 30s, early 40s, when they are just having a bit of sagging, they don't have too much of loose skin. And remember the test that I showed you, stand in front of the mirror or make your patient stand in front of a mirror and see the vertical movement. If the skin movement is less than 1 centimeter, threads can do the job. If there is too much of laxity of skin, then maybe threads are not a good choice. Techi Yami is saying, is there any drawback after getting a facelift? Well, hold on, we will be connecting again next Tuesday and discussing facelifts in greater detail. Aneda Matthews is saying, thank you Aneda for tuning in. So friends, this was a brief overview of the two main treatments that we do for facial anti-aging, fillers versus a facelift. I have explained to you what you can get if you overfill your face with fillers, and next Tuesday I am going to explain to you how a facelift is something which can change the way you look. I look forward to catching you all next Tuesday at the same time. Till then, stay safe, stay healthy. Good night.